Hi, everyone. My name is Dr. Michael Wald. Thank you so much for joining me for this important and potentially life-saving discussion, which I've entitled Overprescribing of Statin Medications by Physicians. My name is Dr. Michael Wald. I'm known as the Blood Detective, and I'm a doctor of chiropractic. I did graduate medical school and earned an MD diploma, but decided not to get a license in medicine, but I do have that knowledge in my head. And I am also a board certified nutritionist, dietitian, and a sports nutritionist. I provide acupuncture and life coaching. All those different things I combine as needed for my different clients. So let's get into this very important topic. First of all, just a brief disclaimer that this information is not a substitute for sound medical or health advice. It's just for your education. So what you're looking at here is a pretty dramatic illustration here of what happens when the liver is diseased. And this is sometimes a result of statin medication. So I'm not saying, I'll just say this at the onset, that statin medications have no role. They do have a role. But it's my belief after over 30 years of providing natural health to clients is that most of the time, working on nutritional and other lifestyle issues like stress and sleep issues can help lower one's cardiovascular risk and lower the blood fats like cholesterol, triglycerides, LDLs, increasing the HDL. And statins are simply not needed. And even when statins are needed, my personal opinion is that they can be used in much lower doses. So rather than take 40 milligrams every day, a person can sometimes respond to 5 milligrams every other day. So I'm not suggesting you change your dosing. And if you're interested in that, you should talk to your doctor. So let's talk about some of the consequences, the potential health problems that are associated with statins. So first of all, it is liver damage, the liver damage concerns. Long-term statin use can lead to liver damage, which on a blood test would show up as elevated liver enzymes. Those are a sign of liver stress. And then there are cognitive or mental side effects potentially. Some patients experience memory loss or confusion. You know, your brain is largely composed of cholesterol, so reducing cholesterol can result in brain damage in the form of atrophy of the brain, and that could increase risk of suicide, ideation, and depression, for example. Again, it's all nervous system, and if you affect the fundamental ingredients of the brain like cholesterol, you might have these side effects. And then there's nutrient depletion. We're going to go into this in a lot of detail. Patients having poor memory started by their statins. And then there's a questionable focus on LDL cholesterol. LDL cholesterol reduction does not always correlate with lower cardiovascular risk, and elevated LDL is one of the more common reasons why doctors prescribe prescribe statins in the first place. So what are some other issues with statin overprescribing? First of all, statin intolerance rates. Many patients discontinue statins due to various adverse side effects, which we're going to go over in a moment. And then there's also increased risk of stroke in some groups, which studies suggest a higher risk of hemorrhagic stroke in certain populations taking statins. How many of you on statins are aware of that? Probably almost none of you. And then there's metabolic dysfunctions that can be caused by statins. Statins might promote weight gain and insulin resistance, worsening metabolic health, and which have an adverse effect on your lifespan and your health span. The very thing you're trying to improve. So this widespread overuse, statins are frequently prescribed for just mild cholesterol elevations when lifestyle changes could easily have lowered the statins. Questionable benefits for low-risk patients. Many patients without prior heart disease are receiving statins despite uncertain long-term detrimental effects. And then there's increased risk of diabetes. Statins can impair insulin sensitivity, as I said earlier, increasing the risk of type 2 diabetes. This is and the number one cause of death in type 2 diabetes is heart attack, which can be promoted from statins. It just makes no sense. And then there's muscle pain and weakness, a common side effect. You need to know this, muscle pain and weakness. Sometimes, by the way, the weakness caused by statins can only be detected by a doctor doing muscle testing on you. So you might feel fine. But how many doctors do muscle testing on a client to look for what seem to be mild weaknesses in muscle strength, which if caused by the statins is a very serious problem, which indicates that that person should immediately be taken off statins. This is a very key point you must know. I have met with many patients who are on statins and they are positive for lots of these muscle weaknesses. I tell them, go back to your doctor, let them know about this, and in every case, when you point this out to the doctor, the light bulb goes off after the stress response happens, and they take you off statins, and then they look for dietary and lifestyle ways of lowering it. And if those things don't work, then we consider a different type of medication, last resort. And then there's the muscle pain and weaknesses, just so you know, this is called statin-associated muscle symptoms, SAMS. It's a real thing. Mention that to your doctor. Say, doctor, can you tell me more about the SAMS issues with statins? And if they look at you like a deer in the headlights, you need to find another doctor. So let's talk about many nutritional adverse interactions of statins, and deficiencies and these nutritional interactions are so profound that they might exponentially increase your overall morbidity and mortality against not just heart disease, but in many other areas. For example, coenzyme Q10. If you haven't heard of it, please remember this. CoQ10. Statins inhibit the enzyme, an enzyme called HMG-CoA reductase, which is crucial for cholesterol and coenzyme Q10 production in the body or synthesis. And that will lead to muscle fatigue, weakness, and even reduced heart function. So statins can cause coenzyme Q10 deficiencies, which can lead to reduced heart function. And then vitamin D, since cholesterol, listen to this, cholesterol is a precursor. It's needed to form vitamin D in the body. Statins might reduce vitamin D production because if you're reducing cholesterol, which is the main ingredient to making vitamin D, you're going to have low vitamin D. At the very minimum, physicians should be, if they decide that putting you on a statin is the thing to do, they should check your nutrient levels, especially your vitamin D3 levels, because again, low vitamin D increases overall risk of death from any cause. How could this not be checked? In my opinion, it is malpractice. And then there's vitamin K2, which is an anti-cancer agent. It's needed for blood clotting. It's needed for bone density, inflammation control, and other things. Statins might impair vitamin K2 dependent proteins, increasing the risk of, guess what, arterial calcification. That's what you're trading if your statin dose is diminishing your K2, your vitamin K2. And of course, that is a bad reaction. And then there's vitamin A. Statins are known to reduce the transport and metabolism or production of vitamin A, which is crucial for eye health, for immune function, and skin integrity, just to name a few benefits of vitamin A. So far, coenzyme Q10, vitamin D, K2, vitamin A, all can be adversely affected by statin medications. And let's just throw in vitamin E in there. Now, statins might lower vitamin E levels, and we have known for decades now that low vitamin E levels increases one's risk of overall cardiovascular death, including increasing risk of thrombotic stroke or strokes caused by thrombi or clots. Vitamin C. Who would have thought statins increase oxidative stress, which depletes vitamin C, which tries to fight against that oxidative stress because vitamin C is an antioxidant. We also need vitamin C for collagen formation, for joint integrity, therefore, immunity and reducing inflammation, and it can be depleted with statins. And even omega-3 fatty acids. Statins alter lipid metabolism, potentially reducing the body's ability to use the omega-3s, which are essential for heart health, brain health, as antioxidants, as anti-inflammatories. Omega-3s even improve arterial flexibility and reduce the thickness of blood, all beneficial things, which are potentially adversely affected with statins. Zinc as well. Statins are known to interfere with zinc metabolism. Zinc has a minimum of 175 coenzyme effects. So many processes in the body can be adversely affected with statins and how they interfere with zinc use. There's also selenium, another important antioxidant and immune modulator. Statins contribute to selenium depletion. These nutrient levels should be checked with anyone thinking about starting a statin, and if you are on a statin, you want to check these and other appropriate nutritional levels as soon as possible. So again, selenium contributes, or I should say statins contribute to selenium depletion, which is necessary for thyroid function. So the statins interfere with selenium. Selenium is needed for thyroid function. So then the statins could cause hypothyroidism or low thyroid function, which tends to increase cholesterol, among other adverse effects. And then there's folic acid, otherwise known as vitamin B9. Folic acid is depleted potentially with statins. So if you deplete folic acid, you will commonly raise a toxic amino acid called homocysteine, which is well established to contribute to cardiovascular risk, including stroke and heart attacks. So these are very serious interactions. And there are more interactions or adverse interactions. For example, B12. B12 works with folic acid to lower homocysteine. L-carnitine, that's an amino acid that is essential for fat metabolism and muscle function, and it may be depleted by statins, potentially increasing muscle pain and fatigue. So sometimes I should mention to you that if a person has adverse muscle symptoms with statins, if they load up on coenzyme Q10 and carnitine and B12 and some of these other nutrients, they might actually be able to use the statin without causing all these adverse depletions of nutrition, which are increasing the risk of cardiovascular disease in many other ways, not to mention other health issues. So here's the statin alert, what you should know. Muscle weakness and other muscular symptoms from statin medications, myopathy, rhabdomyolysis, statin-associated muscle symptoms, which I said earlier, which is short for SAMS, can be deadly if they're left untreated. So you need to be aware of this. Rhabdomyolysis, a severe breakdown of muscle tissue and release of myoglobulin in the bloodstream, can lead to kidney failure, electrolyte imbalances, and heart arrhythmias, all caused potentially by statins. Myopathy and severe muscle weakness can impair mobility, increasing the risk of falls and overall physical decline, particularly in older adults. In extreme cases, cardiomyopathy, which is a condition of weakened heart tissue and heart muscle, the cardiac muscle, can often develop, leading to heart failure and life-threatening complications. So the approach, what I call the blood detective method, should be comprehensive testing, checking these levels of nutrients. Even if you've been off statin for years and years, if you haven't taken a concerted look at whether or not you have these deficiencies, they may still exist, and that means you still may suffer from the risks of those low levels caused by statins that you took a long time ago. And we want to look at your blood, comparing you not to average people. Those are the ranges that your doctor uses for your cholesterol and your LDL and other factors. You're compared to average men or women your age, and that's fine. But the blood detective method, my method, goes a step further by comparing your blood levels to healthy people. Let me give you an example. We know, and even your doctor should know this because it actually is printed on many of the lab tests, that if you have an LDL, we'll call it the bad cholesterol, that is 130 or below, the lab test will say that you have a normal LDL level. But if your LDL is 100 or lower, that's actually optimal, associated with a far better health and cardiac profile moving forward. And on the blood test, it'll actually say optimal. So that's for one test where we know there's an acceptable range, 130 or lower for LDL, and then there's an optimal range of LDL, which is 100 or lower. But the same is true for most other of your lab tests. There's an acceptable range, and then there's an optimal range, which are based on studies of healthy people. So that's what I use, and that's what I describe in my 500-page textbook called the Anti-Aging Encyclopedia of Lab Tests. That teaches doctors and people how to read their blood medically and nutritionally. And then when we give nutrients to fix these issues, this is important, we will give levels that are much higher than the recommended daily allowances, because the RDAs, the recommended daily allowances, are just minimal governmental guidelines to prevent deficiency. And then there is much higher levels of nutrition, which are more disease preventative and disease treating levels. So what we have here is we want to figure out the best diet for a person that is doable for them. If they would like to consider statins as a secondary consideration if improvements in diet and lifestyle do not work. We want to target the known nutritional deficiencies that commonly result from statin medications. I mentioned a bunch of them just now. And also correct any other underlying nutritional problems that the person has. And we may want to do some advanced testing that you sometimes will not even get from your cardiologist, tests of your arterial stiffness, your blood viscosity. And then we get baselines of these tests, and then we give nutrition and improve the lifestyle. And then we see that these things are getting better, so the person can say, wow, what I'm doing is actually working. So many of my clients come in and they just don't know if their nutritional efforts are even working. Their doctors won't do the appropriate tests. And the reason why they refuse sometimes to do these nutritional tests, right? Why shouldn't your doctor measure these vitamin levels? We know they can be depleted with statin use because they don't get training. That's the problem. So we want to take a look at statins' effect on each individual. We want to certainly look at blood sugar levels. We want to look at arterial health and plasticity. We want to optimize recommendations for stress reduction, sleep, speak about exercise. These are the things we would do first before we jump into statin medications. And if you decide, and if it is determined that, statins are the best thing for you, we still don't want to ignore all of these areas. It's absolutely essential for anyone who wants to avoid statins and try a natural way first, or who decide for whatever reasons, then statins are the way to go. So thank you so much for joining me today for this discussion, which I think is absolutely critical, and it's trending in the news right now. Let me know your thoughts on this or any of my other podcast presentations. Email me at info@blooddetective.com. Check out the website for free content. That's drmichaelwald.com. And I've even provided some additional references here, just in case your doctor tells you that this information is ridiculous. That would be inappropriate and, in my opinion, malpractice. And there is just a few examples of scientific evidence that supports every single statement I've made today. Thank you so much, and I appreciate you joining me, and I'll see you at the next presentation.